Why don't we get started? I'm really excited about this, and I'm really honored that all of you have chosen to take some time out of your day to be a part of this. There's a lot of craziness going on in the world, right? We've got this COVID pandemic that we're trying to navigate and figure out what the future is going to look like, not only for society at large, but in particular, how it's going to affect us individually in practice or in school, and how it's going to affect our family. I have a 3 and a 5-year-old, and I'm really nervous about how that's going to look for them. We're also in the middle of a huge societal shift in terms of race relations and policing, and there's a lot going on. And I know that emotions are heightened, and there are people who are feeling some very raw feelings. And I just wanted to let you know that I honor you, not only what you're going through, but I also honor the fact that in the midst of everything that's going on in the world, you choose to take time out of your day to figure out how to be the best perinatal chiropractor possible. I think what we offer is something that can truly transform the world. And when I say that, I don't mean it in kind of a woo-woo literal, way. And I don't even mean it in the way that, when BJ talked about emptying the prisons and filling up the churches, I don't even mean it in that way. I mean it in the fact that we as chiropractors, when we lay hands on somebody and we adjust their spine, when we reduce those subluxations, and we'll kind of get into all of this a little bit later, but we have the ability to change the way that that person experiences, processes, interprets, and responds and adapts to the world around them. Whether that's emotional stress, whether that's physical stress, every aspect of their life can either be compromised or enhanced through a nervous system that is either working efficiently or working suboptimally. And so coming together as perinatal chiropractors and figuring out what it is that we want to create, not only in our lives, but for other people in the greater world as a whole. I think this is the type of thing that we need more of, not only in our profession, but in the world, of coming together to figure out how we can, really make this place better. And that's one of the reasons why I love chiropractors is you didn't get into this profession for the fame and the glory, right? You got into this profession because the idea of serving people is the highest calling. And going to school and spending all this time and energy and money and all the stress that's involved with not only making through school and passing boards, but associating or opening up a practice. This is a lot that you have to go through, and you're doing it really to be in service to others, which is just amazing. And I think it's important that we take a moment to, honor, the fact that we're doing that ourselves. I think that's great. So what is this, right? What is it that I'm trying to do, with all of this? I realized in the midst of the pandemic about 3 weeks ago that we didn't know what the world was going to look like. We didn't know what education was going to look like in terms of chiropractic. We didn't know what the ICPA seminars were going to look like, which, by the way, we're still, we're starting in person, and there's also a ton of virtual options. But we didn't really know what things would look like. And I thought to myself that it's got to be really hard for chiropractic students who really exist within a bubble, right? This bubble of learning and exploration, of trying things on and challenging each other and figuring out who it is they're going to be and what they want to do for the rest of their life, that bubble is popped for right now, right? We don't know when things are going to return to normal and in what capacity. And I think it's especially important for all of us to be able to come together and figure out, like, what's that next step of your education, right? How can you explore ideas that you're not getting in the classroom? Or how can you explore ideas that have been banned from your school, right? These are things that we need to get together and discuss, because I think that's the big key here. So tonight, I'd like to kind of go over an overview of the philosophy, science, and art of perinatal chiropractic, with the intention that in future months, we dive really deep, right? Like, for instance, one of the topics that I thought of, and I'm totally open to hearing topics, by the way, one of the topics that I thought of was, let's dive really deep into the science of subluxation and what are the physiological processes that happen, what's the stress that builds in the nervous system, how does that affect a human being, whether it's a child or a pregnant, pregnant parent, and what's the value in correcting those subluxations, right? We can spend an hour going through all the science, how to communicate it, what are things you need to keep in mind in terms of communicating with other professionals or with lay people. You know, that's the type of stuff that I'd like to dive in deeper. For right now, I want to make sure that we're all on the same page. You know, we've got, it looks like about 70 people who are currently a part of this, and I'm so grateful that you're here. But we've got students who are really new to chiropractic. We've got doctors who have been in practice for decades. But we've also got people who run the philosophical spectrum, right? What I mean by that is we have students that go to very musculoskeletal based schools, which is great. And I'm so glad that you're here. And we have people who go to much more, how shall I say, vitalistic or physiologically traditional views of chiropractic. And the people who are on this call, who are going to be a part of this, really have a very wide understanding of what chiropractic is. And it's important that if we're going to have a conversation about some of these things, we need to get on the same page, right? We need to make sure that we're operating from the same context, so that if I start talking to you about subluxation, that everybody on the call understands what subluxation is, and that we're not operating from a place of people feeling confused or left out. So I'm going to do my best to keep that in mind. But if we're ever going through any point of whether it's this call or future calls, and you feel that we're missing something, or you feel that you don't understand a concept, please unmute yourself, interrupt me, or honestly, if you don't feel comfortable with that, I'm gonna look at the group chat on the side. So feel free to post like a little, hey, shut up, let me listen, let me talk to you about left off.
You said shut up and interrupt me.
So one of you took that literally and just kicked me off, right?
Yeah.
Okay, yeah, I have no idea what happened there, but let's go forward. So I want, if there's a topic that you don't quite get, please let me know. I want everybody to be on the same place, so that way we can really connect and really help enlighten and explore some interesting topics for everybody. Is that fair? Do we have thumbs up that's good? Does anybody have any questions about what this is going to be or what we want to do? No? Okay, cool. So let me do, this is a presentation that I did a little while ago at Life West. All right, are you seeing the presentation in full view? Like full screen view? Yeah?
Yeah.
Okay, cool. So first off, when we're talking about this, a big part of the conversation is like, who am I, right? For all intents and purposes, I'm just a practicing chiropractor like many of you. I graduated 8 years ago, 9 years ago, and I've been in practice for the last 9 years. And so what is it that, like, where's my come from? All right. I always think it's important that you trust the messenger before you trust the message. So what is it that, gives me any sort of authority in order to speak into this? Well, let me share a little bit about my journey. I am a second generation chiropractor. That is a photo of my dad adjusting me when I was 2 years old. You can tell by the wonderful Oshkosh Bagosh overalls and the wood paneling on the walls that this represents the late 80s. You could actually see that the armrest on the table is a nice like suede velour, like the juicy sweatpants. So this is like super 80s classy. If any of you know my father, he practiced for 30 years and he still looks exactly the same today as he did in this photo. So by the way, this is not an ICP FDA approved chiropractic adjustment for children. We are going to go in a future class all about how chiropractic can be applied in a way that is not only safe and effective for the child, but also gives a caretaker, like a parent, a peaceful feeling watching it, right? Which I think is incredibly important in how we present what we do. So, I grew up getting adjusted. My dad adjusted me from the day I was born, and I was checked regularly throughout my entire life. But I think an important distinction is that my dad really never understood in great detail why he was adjusting me. That was just something that you did as a chiropractor, is you adjust your children. Yeah, of course I adjust my children. And so he didn't really have a philosophical basis to explain to him why getting me adjusted was such an important aspect to my development. He went to NYCC, New York Chiropractic College, when they actually had a pretty good repertoire of philosophy instructors, which was nice. But he was very like musculoskeletal orthopedic based, right? He graduated as the salutatorian. He believed that the reason those quote unquote, subluxation based chiropractors don't diagnose is because they're clearly not smart enough to diagnose. That was the framework of his, being brought up in the profession. And so when it came time for me to go to college, I knew without a shadow of a doubt that I was going to be an orthopedic surgeon. I was an athlete in college or in high school and going into college, and I had some injuries, and I went to the orthopedic surgeon, and they were amazing, right? They had this incredible practice and incredible lifestyle. Basically, orthopedic surgery is a license to print money. And so that was very appealing as a high school athlete. And I got into undergrad. I went to University of Florida. And I was learning all about, anatomies and physiologies, and I was going through all of this. And I realized that what I was being told in my pre-med classes didn't really resonate with the lifestyle that I was brought up on, right? It didn't make sense with my understanding of, the anatomy and physiology with what it was that they were trying to tell me that they do in order to, treat the body. And so I started asking my dad questions, and it just so happened that at the exact same time that I was going through my kind of questioning my decision to be a pre-med student, he went to, if any of you know Total Solution, which is the people who do the Insight Subluxation Station, they had a retreat where they would bring chiropractors out to Colorado at the time, and they would do this huge retreat all about like personal growth and understanding subluxation theory and how it affected people in terms of, the computerized scans that they use to assess for subluxation. And so he got out of this Total Solution program, and he was just so fired up. For the first time in his career, he really understood and valued the role that chiropractic had in terms of overall health and well-being and the experience of our body to interact with the world. So he decided that he was going to put together a patient education CD. And this was, back when new cars actually came with CD players. But he had the CD, and I'll never forget, the title of it was The Magic in You by Dr. Howard Shulman. And I still laugh every time I think of that, because it's probably the cheesiest name for any sort of, chiropractic thing that I can think of. But I think it was so beautiful in the sense that he spoke for the first time in my life, right? I've been getting adjusted 20 years, but for the first time in my life, I understood why I was getting adjusted. I understood what happened in my body when I was subluxated and what he was doing when he put his hands on me to make that correction. And that was all of a sudden like that proverbial light bulb just flicked. And I said, this is what I want to do. And he started telling me stories of patients that were infertile, and he would be adjusting their back pain, and all of a sudden they'd be able to get pregnant. And people who, were so depressed and borderline suicidal that he would start adjusting them for migraines, and all of a sudden, boom, they were new people. And I said to him, why isn't that you ever told me about this? You've been a chiropractor my entire life. How is it that I've never heard about this before? And he said something that sticks with me to this day. He said, Ian, you practiced for 30 years and you just come to expect it. And that to me was like mind blowing, right? Like, and any of you who've been in practice for any length of time, you get to a point where you expect people to have those really dramatic changes in practice. And so all of a sudden I just got lit up. I said, this is what I want to do. And I assumed he was going to tell me to go to, his alma mater. And he told me instead, he says, Ian, I want you to go to Life. And part of the reason was, the faculty and the administration at the time. But he says, I want you to go to Life. And I said, all right, I'm there, let's go. So I start first quarter and I'm going through everything, and I'm kind of getting bogged down in like the anatomy and the medical terminology. I mean, you know what it's like in first quarter. It's just like a bunch of stuff that you need to get through in order to get to the juicy part, right? Nobody goes to chiropractic school to learn medical terminology or basic anatomy. You want to get your hands on people. You want to adjust. You want to start taking care of people. And so I was kind of getting bogged down, and I was losing that drive. And a friend of mine said, why don't you come with us to Pierce Results Club? And it was just one of the technique clubs on campus. But I showed up, and this chiropractor, our philosophy instructor, opened the book to this big fat green book. And he opened it to chapter 11 on the book, The Bigness of the Fellow Within. And I'll never forget what he started reading. He said, we chiropractors work with the subtle substance of the soul. We release the prisoned impulse, the tiny rivulet of force that emanates from the mind and flows over the nerves to the cells and stirs them into life. We deal with the magical power that transforms common food into living, loving, thinking clay that robes the earth with beauty and hues and scents the flowers with the glory of the morning air. In the dim, dark, distant long ago, this power spoke and there was life. It quickened the slime of the sea and the dust of the earth and drove the cell to union with its fellows, producing countless living forms. Through eons of time, it finned the fish and winged the birds and fanged the beasts. Endlessly it worked, evolving its form until it produced the crowning glory of them all. Through tireless effort, it blows the bubble into each individual life and then silently, relentlessly dissolves the form, absorbing the spirit into itself again. And yet you ask, can chiropractic cure appendicitis or the flu? Have you more faith in a knife or a spoonful of medicine than the innate power that animates the internal living world? Right? That was my first time ever really seeing, what chiropractic was. That was my first time really understanding that every time my dad adjusted me throughout my entire life, there was this intelligence that was working in my body, and he was helping my body be better connected to it, to this intelligence that takes, a single cell and then turns it into a human being, right? So I was just like floored. And a couple of weeks later, I was sitting in class, and one of our instructors brought out this, and it's Life magazine from 1965. These are the first color photos ever taken inside of a mother's womb showing the developing baby. And I just thought this was really amazing because he started off with a picture of sperm. Now, I know when you signed on for this conversation, you were not expecting to have a screen full of sperm. But what he showed me was that in the top photo, right, the one in the top left of your screen, there was all of these sperm swimming in all different directions. And in the bottom photo, they're all going in the same direction. And that the only difference between these two photos is the presence of an egg available to be fertilized. That these little half cells of genetic potential understand when to try, where to go, how to get there, what to do when they get there. And in those moments, that egg and that sperm join together, a half cell and a half cell, to create one human cell. And through a process of dividing and dividing and differentiating, that single cell turns into a baby, right? And that the arm buds come out and rotate in order to form the legs and the arms, that the eyelid develops as a result to changes in the amniotic fluid, that all of these things are happening in the body, and that the nervous system is the main thing that guides its development, right? That's where that intelligence operates, that everything BJ talked about regarding this innate power that animates the internal living world is being expressed through that nervous system, right? Now, this is combining, right, embryology science with the philosophy of chiropractic and really understanding what it is that we do, not only from a philosophical, let's get excited place, but from a scientific, let's understand how this process actually works. And so I saw this and I was just blown away. A couple weeks later, I got an opportunity to hear Jeannie Ohm. And, you know, I knew I wanted to be a chiropractor. And I got really excited about this idea of chiropractic and its potential to impact pregnancy and birth and embryology and everything. But it wasn't until I heard Jeannie Ohm for the first time that I really understood the capacity that we have when we put our hands on somebody and we influence their pregnancy or we influence the birth process. And she spoke so passionately and she spoke so eloquently about the value of chiropractic for a pregnant person and the value that chiropractic has in terms of their preparation for birth and their transition into being parents and how that baby enters the world and how the rest of that child's life is absolutely impacted. And I knew in those 45 minutes that I heard her speak that this is what I was going to do. That what she shared with me is that everything BJ talked about, the innate power that animates the internal living world, and what I just learned about embryology is that she put it together and she showed how pregnancy, birth, and the transition into parenthood is really the embodiment of the full potential of innate intelligence. And that was, for me, was just unbelievable when I realized like what the potential was. And I decided in that moment that I was going to be a perinatal chiropractor, that's what I was going to do the rest of my life. A little aside, about, I don't know, I guess it was 2 years ago, Jeannie and I, we started talking a little bit more about like stuff with the ICPA and the future of the profession and where we were going. And it was a month before the ICPA summit, the big Freedom Family Wellness. If none of you have been there, or if you haven't been there, absolutely plan on going in the future. It's incredible. But she asked me to speak. And a month before, she calls me up and she says, "Why don't you have your diplomate in chiropractic pediatrics yet?" And I said, "Well, I'm certified. I don't know, like I haven't gone further." She goes, "Enough. Get all of your information to me in 2 weeks. Get it done. I want you to be a diplomate by the time the summit comes around." And if any of you have explored the ICPA certification process, the first part is completing all the seminars and then taking a written exam. The second part is all practical. It's filming your consult and your adjustments and writing an article and writing research and doing everything to show that you've been able to master this information and apply it practically. So she said, "Get it to me all in 2 weeks." And I was terrified. My associate was just like, "What do you think you're doing right now?" But I was able to get it done. And she pushed me to go beyond where I was comfortable in furthering my understanding of perinatal practice. And 3 weeks ago, the motivation for doing this tonight, was that I thought to myself how much of a shame it was that chiropractic students, one, won't get a chance to hear Jeannie Ohm, and two, that they don't know when the next time somebody's going to be able to come on practice and light the fire in them the way that Jeannie lit the fire for me. And so I decided that I was going to do this event. And I just went online and I basically picked a day and I said, all right, Monday, June 1st. And I woke up this morning and it's Jeannie's birthday. And, you know, I just, for those of you who got a chance to know her or learn from her or, you know, talk with her, you know, she was the embodiment of perinatal chiropractic. And her passion is still not only pushing me, but everybody who she's ever taught is still being, you know, driven by that. And I just thought it was just such an amazing thing that today was her birthday. And, you know, I just, you know, if everybody at some point just thinks about what she's done for our profession, I think that would, you know, be a wonderful thing. So, excuse me. So, you know, I left her class and I was in first quarter and I knew this is what I was going to do the rest of my life. There was no doubt about it. And I was that kid in chiropractic school where I would sit there and I would draw like blueprints for my office and I would draw my logo and I would do all of these things instead of doing the things that I was supposed to do in school. I was just that singularly focused, you know, and I had the idea that I was going to have a birth center and a chiropractic office combined, and that's how I was going to, you know, live everything. So long story short, I graduate and I moved down to South Florida and I open up practice. And at the same time that I'm opening up practice, there's a local birth center that is opening up and they're interviewing chiropractors. And they want somebody to come be a part of it. They had absolutely no expectation of ever hiring a guy to come and work with them. They openly admit to me today that they thought I was gay, which is the only reason why they felt comfortable with a guy coming in as a chiropractor, which, you know what, you know, it is what it is. But it was amazing because I started very early on with just a few weeks of experience getting to work with a lot of pregnant women and work with a lot of young children. And I was in the office on a Saturday morning. It was probably like 10:45 in the 10:45 a.m. I was just finishing up with patients and I was getting ready to leave. And I get a phone call from one of the doulas who worked with the birth center. And she says, you know, I have a mom here and her labor has stalled. We had to transfer her to the hospital. Her waters have been broken for 24 hours. Her baby is still very high, right? -2, which is still kind of floating. Baby's not even engaged. Her water's been broken for 24 hours. She's been on Pitocin for the last 12 hours. Nothing's changing. She's not feeling any contractions. She's only 4 centimeters dilated. They're getting ready to prep her for surgery. Is there anything that chiropractic could do? And I had no clue, right? But what I knew is what Jeannie taught me. And what I knew is that if somebody was subluxated, if their spine or pelvis was not moving as well as it should have been, and that was compromising the nervous system, then there was no doubt in my mind that that can interfere with the birth process and get in the way of this mom being able to progress to the birth that she wanted. And so that was it. I immediately said, yes, absolutely, chiropractic could make a difference. And I said, if the doctor and the midwife are okay with me coming to the hospital, I'll come to the hospital and I'll adjust this mom. And so I get there and she is, you know, wearing a gown. Her name's Trisha. I'll never forget. And she's holding an IV bag, you know, the stand. She's got her IV in and she's walking up and she goes, "Oh, hi, I'm Trisha. It's so nice to meet you. Thank you so much for coming here." And if any of you have been around birth, you could typically tell how far along somebody is based on whether they acknowledge your existence and how much clothes they're wearing, right? Because if you walk into a birth and that person is completely naked and they are not even aware that you walked in the room and all you hear is them, "Ooh," you're getting close, right? But this was a woman who 24 hours into labor, 12 hours on Pitocin, there was no imminent, you know, change in terms of, you know, when her possibly having a vaginal birth. So I said to her that She'd never been adjusted before. So I told her, we're going to find these subluxations and we're going to make the correction. And if I can correct those subluxations and allow your nervous system to regulate everything better, there's a good chance that it'll help make space for baby and your body will start to contract and things will progress, right? And I said it with the confidence of somebody who actually knew anything about what I was doing, right? This was, I mean, I was just making it up as I was going along, but I knew, right, from my understanding the science, philosophy, and art, I knew that if I were be able to find objective indicators of subluxation and correct that, that this would have a positive impact on you know, the function and ability of her body to adapt to pregnancy. So I go and I adjust her. It was left Webster, and I you know, adjusted the sacrum using like the Gillet's, you know, 8-point flexion. I had her stand and march in place, looking at how the pelvis, you know, the ilium and the sacrum moved, and I just held some pressure, just like this photo, and I just kind of did. If any of you are NUCA people, I did like a triceps, you know, triceps pull. Right? And I was just trying to introduce motion into that sacrum, hoping to alleviate some of the signs of subluxation, right? Some of that nerve interference. And I told her, you're all set. Give it 20, 30 minutes, and I think you're going to notice a change. And I left, and I told the doula to call me when there's an update. I was terrified. For the next, you know, 24 hours, I basically just sat there staring at my phone, praying that I would get a phone call, because I had never done this before, right? I was fairly convinced that I had just killed this mom and baby, and that chiropractic was not only going to be banned from hospitals, but chiropractic was going to be over, right? I single-handedly just ruined chiropractic for the world. Well, I didn't get a phone call back. So at 6 in the morning, the next morning, I call the doula and I say, what's up? And she said, oh, I'm so sorry. I didn't get to call you. Right. And she said that after I left, about 30 minutes later, mom had a second release of fluids, and they immediately checked her, and she went from 4 centimeters to 7 centimeters. She went from -2, really high, to +2, really engaged. She started feeling contractions for the first time in her pregnancy, and started feeling pressure in her pelvic floor. And 3 hours later, she was able to progress to a vaginal birth. And, you know, birth is one of those things that is not only about getting baby here, it is a significant moment where it imprints on the soul of both mom and baby, right? Or both, you know, parent and baby. It is a defining experience for people. You know, I'll never forget when my wife gave birth to our second son, and she did so at home without any medication. The confidence and the pride and the transformed perspective of who she was as a human being and what her body was capable of, that is a defining moment in her life. And I'll never forget how that changed her. You know, unfortunately, women in our society are indoctrinated from an early age to think that they are not good enough, that their bodies are not good enough, that they're not capable, that they need help, that they need something from the outside in to be able to allow their body to work. And what I realized through listening to Jeannie and BJ and my experience with this mom, Trisha, is that chiropractic can have a dramatic impact on how that birth goes for both mom and baby, right? Not only the physical and the emotional impact that it has on mom, but how that baby's future, right, is transformed. Studies show that babies born via C-section, like myself, are more likely to have autoimmune issues or digestive issues later on in life. Right? We know as chiropractors that the compression and opening up of those cranial bones during birth is important for the CSF pump. We understand that feeling contractions and going through that is important for our nervous systems to wake up as newborns. And in this instant, at least, that probably wouldn't have happened if it wasn't for chiropractic being available for this mom. And so I knew in that moment that the rest of my life was going to be dedicated to this mission statement, making chiropractic available at every birth for every parent and every baby everywhere, right? And that's what this is about. I don't have anything to sell you. I teach for the ICPA. I do a class on ethical communication in the perinatal practice, and I think everybody should take it. But that's not what this is about, right? I don't have anything to sell you. I'm really here because this is my life's work for all intents and purposes, and I can't do it without chiropractors and future chiropractors being 100% on board and being not only willing to, but knowledgeable in the science, the philosophy, and the art of chiropractic necessary to create these changes in the world. That's what I want, right? That's what this is designed for. So if you're on board with this mission statement, then this is going to be for you, right? It's going to evolve and it's going to change over time. And I want to hear as we go through this, what it is that you want to hear and what it is that you want out of this. So please, make sure after I finish with my little brief thing, I'm going to open it up. So for Q&As and conversation and discussion and all that, but this is it, right? This is the whole shebang when it comes to what this is about. So if you're on board with that, then you're in the right place. Now, especially if you're a student, you can't just go out and create a perinatal chiropractic practice without really understanding the foundational premises of what it is that we're talking about. So we need to address, and you need to take time when you're in school, or if you're already out of school and you're a doctor, you need to take time to further develop your understanding of the philosophy, science, and the art of practice, because I'm not joking when I say it guides everything that you do. So let's start with talking about the philosophy real quick. Now, when I talk philosophy, I'm not just talking about green books, right? If you're not a big fan of reading green books, well, join the club, right? Besides that one, thing that I memorized that I read, I recited to you in the beginning, I don't particularly read green books just because I'm not a big reader outside of stuff that really gets me excited. And to be honest, BJ's writing is a little dry for me sometimes. So, the thing about philosophy is you need to realize that everybody, all of you have a philosophy. Whether or not you choose to define and rationalize and understand your philosophy is a completely different topic, right? Some of you go to schools that really emphasize, quote, evidence-based chiropractic. Well, the reality is people who pretend that philosophy is a relic of our past, that it's a historical footnote, they don't understand what philosophy is, because our philosophy is the foundational understanding of the world around us. It's the paradigm through which we view the world. Our philosophical understanding drives us to ask questions, right? It asks the questions, why does this matter? Why am I doing this? And it affects everything that you do in practice. It affects your communication. It affects the techniques you choose. It affects the people that you choose to see in your office, the recommendations you have for care, how you communicate what you do. There is no part of your life as a chiropractor that is not influenced by your philosophy. So it's time for you to understand and define your philosophy for yourself. Right? What is it that you believe chiropractic is? What is it that we do as a profession? Because if your foundational premise, if your philosophy says that chiropractic is about natural healing, right, for instance, then you better think about everything that falls within the confines, within the context of natural healing. Exercise, nutrition, mental attitude, supplements, physical therapy, acupuncture, right? And you can see how if your understanding, if your philosophy of chiropractic is natural healing, then it becomes your obligation to discover every facet of what natural healing can offer and incorporate what you choose to incorporate into your practice. And I think this is where a lot of chiropractors who really fall in love with chiropractic and particularly fall in love with kind of the family wellness side of chiropractic sometimes because their philosophy is a little bit broader in the sense of like natural healing, they start to incorporate more things into their practice, and their practice almost becomes all things naturally used to treat problems, right? And so if you instead choose to define your philosophy of chiropractic as the restoration of normal neurobiomechanics for the enhanced expression of innate intelligence through life, right? Just as a complete, like, kind of, opposite, then everything that you do, everything that you gear towards is going to be focused about how to better correct subluxation in your patients, right? In your practice. And so I'm not telling you what to believe, right? My dad's philosophy was much broader than my philosophy when I chose to graduate, when I graduated and chose to open up practice 30 minutes from where he was in practice, right? I did so because I knew that within the context of his philosophy, I wasn't going to be able to practice the way that I knew was authentically me, right? Some of you are associates and you've joined practices that aren't authentically you, that you have to sacrifice your philosophy, you have to sacrifice your vision in order to operate within the context of the practice that you're employed with. And that's not necessarily a bad thing, but recognize that that happens, because unless you're aware of it, it becomes easy for your philosophy and your belief about how the world in this profession should operate. All of a sudden that philosophy gets blown out and you just adopt whatever the owner of the practice does, right? Which isn't a bad thing unless it's not what you want as a person, okay? This is an amazing profession and we have the ability to practice authentically to ourselves. That's one of the amazing things about this profession. It's also one of the frustrating things because you walk into 100 different chiropractors' offices and you get 100 different things. It's why if you've ever tried to refer a patient to another chiropractic office, you hold your breath because you're not quite sure what you're going to get, right? But for you to really find contentment and fulfillment in practice, you need to spend time figuring out how you feel about the world. It is absolutely essential for you to understand your philosophy in order to avoid contradiction. And the amount of contradiction you have in your life is directly proportional to the amount of failure you have. If you were trying to operate a family wellness practice, but your philosophy is natural treatment, and you're doing everything around the context of treating injuries and treating disease with natural means, you are going to find a discrepancy, a contradiction that's going to get in the way of your ability to create the practice you want. In the same way that if you want to see a lot of family wellness stuff and you've got a practice that says, as my dad's practice was, Sunrise Physical Medicine Center, it's really hard to develop that type of practice when you're labeling to the world and representing who you are, that this is what we do, right? Boynton Pain, Rehab, or Boynton Pain and Rehab Center. That tells the world a specific thing, but when people don't define their philosophy, they create this contradiction, this disparity, and that's where they struggle. That's where they fall apart. I'll give you a great example about this. I had a patient that came into my office, and she was 23 years old. She was incredibly fit. She was a yoga instructor, very flexible, great range of motion globally. But she was getting constant neck pain and tension headaches. And I told her all about what we're doing, that our job is to reduce the subluxations in your spine. And if we can do that, your body's going to have a greater capacity to adapt to the world, and your body will be able to heal and function better going forward in your life, right? And so she was all on board. She said, great. And I did an x-ray. And not only did she have a reverse curve like this, now like pretend that this is like a normal curve, like her reverse curve was like completely the opposite direction. And she had absolutely no disc at C5. It had completely atrophied, and there was major osteophytosis on both sides at both levels. It was, probably the worst degeneration I've ever seen in somebody so young. And I explained to her that what we're going to do, correcting these subluxations, is going to be incredibly valuable to her ability to heal. But I remembered what is it? Principle 7, all processes require time, right? Or there is no process that does not require time. I told her that this is going to be something that's going to take time. And it's going to be a process that as we reduce this subluxation and we kind of unwind the tension in her body, that it'll enhance her ability to heal and she'll gradually get better if we can do that. And she bought into it. The reality is that for the first, 6 weeks, 5 weeks that I was adjusting her, I was correcting her subluxation. She walked in, objective indicators of subluxation. She walked out completely clear, but she had absolutely zero relief, zero change. Now, if I wasn't crystal clear in my philosophy, right, and understanding what it was that I was doing, I would have jumped and added in a bunch of other stuff, which isn't necessarily a bad thing. But I've noticed that in many chiropractic offices, when you add things, you're very often adding it not to supplement the adjustment, but many people add it to try to treat the problem while ignoring part of chiropractic care, okay? And so I started saying to her, like, you know, let's keep you focused, right? And she was doing all the other things. She was getting massage outside of my office. She was doing supplements. She was obviously doing all the, you know, these exercises. She was doing all of the things, but she wasn't getting adjusted up until the point that she came to my office. So we kept adjusting her. And all of a sudden, I think it was like visit 11, she comes in and she says, there was something different. After last adjustment, I noticed that I didn't have the numbness in my hands that night, that it felt better. I said, awesome, lay down, let's get you checked for subluxation. And I adjusted her again. And she came in the next day or a couple days later, and she had absolutely no symptoms whatsoever. She was no tension in her head, no neck pain, no numbness in her hands. She was absolutely ecstatic. And you know what the coolest part about it was? When she laid down on the table, she was completely holding her adjustment. She didn't need anything, right? My philosophy tells me that if somebody is subluxated, it interferes with the capacity of their nervous system to perceive and adapt to the ever-changing world happening around them. Now, what does that mean? Every day we are bombarded with physical, chemical, and emotional stresses. And our body has an innate defense, right? Adopting a sympathetic state, a fight or flight, which is designed to help protect us from those immediate dangers. But it often does so by sacrificing long-term function, almost like a circuit breaker flipping the switch to avoid the power being blown. And that these subluxations keep us alive, but if they stay there, if they're not addressed either by self-resolution or through chiropractic, they can start to lead to dysfunction where the body is less capable of adapting in the future. And so from my perspective, as long as she was coming in with objective indicators of subluxation, there was justification for continuing care, and she had not yet reached her healing potential, right? And so this woman's life is, you know, I mean, she's continuing to coming in for care, right? She comes in every couple of weeks and she's doing amazing, and she hasn't had symptoms in a couple of years, and it's wonderful. But that wouldn't have happened if I wasn't crystal clear about my philosophy. Now, if your philosophy is a little bit broader and you want to incorporate other things to support your patients, if you want to do rock tape to help your pregnant patients deal with their bellies, if you want to, you know, do supplements to help your patients, you know, all of that is fine, right? But make sure that you're at least making subluxation correction the foundational component of what it is that you do. Because I've got a secret for you. And in case nobody's told you this, the only reason you as a chiropractor exist, the only reason that the chiropractic profession is really needed, the only unique thing that we offer to the world is subluxation correction. That doesn't mean that there's not other valuable things that we can do, but that's the only thing that is completely unique to chiropractic care. And so if I told you, for instance, that there's a profession that was going to help people alleviate pain, improve their posture, and live a healthier lifestyle, you have no idea what profession that is, do you? Right? You don't. Could be a physical therapist, it could be a massage therapist, it could be a personal trainer, it can be a, you know, I mean, it could be anybody. But if I told you that the role of chiropractic is to enhance the ability of the body to interact with the world around us through reducing subluxations, and you can even add, and supporting with, supplementary or complementary recommendations, now all of a sudden there's value for what we do. And I think this is really important because as we branch out into the greater healthcare world, it's more and more important for us to offer something that nobody else offers, right? And so, that's one of the reasons why I chose to keep my practice just as chiropractic. My dad had a massage therapist his entire practice, his entire career for 30 years. I think massage therapy is wonderful. The reason why I chose not to incorporate it into my practice is simply because the birth center that I was trying to join and be a part of had a massage therapist, and they weren't going to bring somebody on who may potentially compete with them, right? And so being just exclusively chiropractic has allowed me the opportunity to really build relationships with other professionals, whether it's acupuncturists or massage therapists or yoga instructors or pediatricians and OBs and midwives and all these other people. It's allowed me to bring those people into the chiropractic paradigm and actively refer for subluxation correction because they understand how important it is, and they see value in it for their clients. And that, I think, is a really important thing that we don't do enough of, is build relationships outside of the profession. And that's something that we're definitely going to spend an entire conversation about, how to build bridges with your local pediatricians and OBs and midwives, etc. So, define your philosophy. If you're in school, if you're a student, oh gosh, I mean, this is the time to figure it out because, you don't have bills to pay, right? You don't have overhead and staff and malpractice and licensing fees. If you're an associate, go for it. Screw up on somebody else's dime, right? That's kind of the benefit of it. But don't open a practice until you figured out exactly who you are and what makes you necessary for the world. Right? I think that's just important. A couple things that are going to support you. You may want to write these down. I strongly recommend Reggie Gold. If any of you have heard him speak, he's got this wonderful talk. I think you can find it on YouTube now. It's called The Valley of the Blind. That was transformative for me. I think he did it at a Lyceum at Palmer, but it is absolutely amazing and a wonderful kind of inspiration into this philosophical world of chiropractic. You can also look at, if you want to better understand the type of philosophy that I'm speaking into, you can also look up The Great Chiropractic Debate, also by Reggie Gold, on YouTube, right? That's a wonderful resource. If you want to better understand how chiropractic, right, subluxation correction fits into the overall wellness healthcare paradigm, James Chestnut has a wonderful series called The Science of Wellness. It's a 2 CD set. I actually have it. I'll see if I can upload it or get it to you or get you a link. But it is a great resource. And if you didn't get a chance to write these down, I'll go ahead when I email the recording to everybody. I'll make sure that I include some links to these things because I want you to be able to see it. And it's a really good way to just inspire yourself and get connected to everything. So how about the science of chiropractic? Well, if philosophy asks the questions about why, right? Science answers the question. It validates, or it investigates and validates the underlying premise that the philosophy is trying to explore. It allows us to refine our philosophy. It's the science that helps tell us if our philosophy is congruent and if it makes sense, or if it's something that is not based in reality. And the truth is that the foundational premise of chiropractic is that there's a universal intelligence that gives to the world organization and helps keep things in existence. And that's something that if you operate from there and you continue to go down through like the 33 principles, you'll see that now more than ever, the science that's emerging, especially on tone in the nervous system, the science that's emerging is validating, maybe not in the same terms, but it's validating the things that Didi and BJ wrote about 100 years ago. we have to realize that BJ's writing, talking about innate intelligence and talking about life force and talking about toxins, traumas, and thoughts, these are words that he had to create, right? They didn't exist. And certainly the terms that we might now use to describe it, those words didn't exist when BJ was developing all of this. So it's pretty cool when you start looking at the science and you realize that, yes, in fact, the science backs up that subluxations exist, and subluxations compromise the ability of the nervous system to regulate normal bodily function. That yes, subluxation disrupts the immune system. That yes, subluxation reduces our capacity to adapt to an ever-changing world. These are things that BJ wrote about and that we discover the science validates it. The problem is, in the same way that, people will say, well, there's no science that shows that there's any risk of vaccination. You also have chiropractors and other professions who say there's no science that validates the concept of subluxation. And the truth is that you have to realize that when people come in to looking at the science, very often they come in with their own biases or agendas, and they're not willing to explore or look at the greater body of evidence that does in fact show that subluxations are impactful. And so you always need to keep that in mind, because there absolutely is published research. Now, the question is not, is there research? Is there evidence? The question is, will that person accept that evidence, right? It's always about what's the level of evidence you're willing to accept in order to be wrong. And that's the problem, because you'll tend to find that if somebody has their mind made up, they will not accept anything, right? There's nothing that you can give them that would allow them to feel safe in conceding your point. So your job, whether you're going through school or whether you are out in practice, is to understand the science, not just of subluxation correction, right? And we're going to spend an entire, conversation all about going, delving deep into the science of subluxation, both anatomically and neurologically. But you also need to understand the science of physiology and the science of pathology and disease, because your job as a chiropractor is also triage diagnosis, right? I've never understood chiropractors who say, well, I refuse to diagnose, or I refuse to look at anything other than subluxations. I'm a principled chiropractor. Again, science, philosophy, and art is a three-legged stool. You can't exist without all three legs. And there's no such thing as a philosophical chiropractor, because that person doesn't understand the role science plays in validating the philosophy. You can't have a philosophical-based or a science-based chiropractor because they wouldn't have a philosophy that allows them to investigate what's real and what's, like how to practice. So you need all three. And what that means is that when you're in practice, even if you were the most straight of straight chiropractors, you need to understand the science of if what you do with your patient is going to be safe. I'll give you a great example. I had a patient, her name was Glenda. She came to me during both of her pregnancies. We continued to see her afterwards. And one day she walks into the office and she says, I'm checking her, I'm doing her legs. And I say, anything new or different? And she says, oh, nothing. And I start to, I see that her legs are off, and I go to toggle her atlas. And she then just mentions to me, she goes, oh, but I had a really bad headache this weekend. And I immediately kind of pulled my hand off and I said, okay, this is something that you share with me before I go to adjust you. I don't remember you getting headaches. What's the deal? And she said, well, it was really weird. I bumped my head this weekend, and I noticed like later that day, I started getting this just like terrible headache. I had a hard time seeing. I started getting this like weird tingling sensation on one half of my body. I was feeling really dizzy. Now, if you know anything about like chiropractic and stroke, your brain should be like blaring red flags, right? And I stopped and I started asking her questions. And I understood the science of what's happening in the body, not only in terms of how to correct that subluxation, but in terms of how to ensure the safety of my patient and to make sure that my patient belongs in my office right now at this moment. And I did a workup and I did everything and I said, listen, this is what I'm concerned about. I really don't want to adjust you until we get you screened because I'm very concerned about this. What's fascinating about it is she told me the day before that she went to urgent care and urgent care just told her, oh, don't worry about it. Just take a couple, Advil. And so you can't trust that just because this person's been to a medical doctor that it absolves you of all responsibility as a doctor. You need to first and foremost make sure that your care is going to be delivered safely and that the person in front of you does not need to be sent elsewhere. And you can't do that unless you explore the science of diagnosing pathology. You can't do that if you don't understand what certain things mean in the body. And so you need to be able to figure that out. And your ability to do so will absolutely influence your ability to keep your patients safe and to represent chiropractic in the greater context of the world. Because I'll give you a little secret. Chiropractic does not cause strokes, right? Chiropractic does not cause strokes. There is zero evidence to suggest that chiropractic causes strokes. We do have evidence that there's a temporal relationship, right? We do have evidence that chiropractors miss strokes, that they don't identify them and refer their patient for appropriate medical care. That's where chiropractors get in trouble, right? Because you get sued, right, in terms of malpractice for two things. If your patient has an injury and you did not follow the standard of care, right? In case you're wondering why pediatricians rarely make a recommendation outside of the CDC's vaccine schedule, because they know that that's the standard of care, and if they operated outside of it, they put themselves at risk if the child gets hurt. In the same way that the standard of care, if a person comes into your office and they're presenting any signs of a stroke, is you need to be able to identify it and refer them appropriately. If you miss it, that's when you get in trouble, right? If you adjust them and you're convinced that their symptoms are because you adjusted them on the wrong side and you want to go and correct it by adjusting them in the opposite side, that's what gets you in trouble. If you try to hide it by telling the person to drink water and go home, that's what gets you in trouble. If somebody came to your office and you did a workup and they had no signs of a stroke and you adjusted them and they end up progressing into having into a stroke, that doesn't necessarily mean you missed anything, especially if you document appropriately that you followed everything and you followed the standard of care. And that you'll talk to anybody with malpractice, including Matt McCoy, who does the Chiro Futures and the Foundation for Vertebral Subluxation. He'll tell you right off the bat that if you did all those things, he'd be happy to take your case. But if you ignored those things because you're a principled chiropractor that doesn't diagnose, then you are screwed in terms of your malpractice risk, right? But you can't do all of this. You can't do it if you don't understand the science of what it is that we do. So yeah, study urinalysis. Yeah, study gynecological exams on rubber pelvises in your OBGYN lab. Do all of those things, not because you're going to do it in practice, because it gives you an understanding that allows you to better serve your patient. When I had a mom who was postpartum a couple weeks, and she was having this constant low-grade fever, and she'd been taking Tylenol and Tylenol and Tylenol over and over and over for weeks because that's what her OB told her to do. And I asked her a couple simple questions, and she told me that she'd still bleeding and passing clots. It was my understanding from that OBGYN lab that she may have a little piece of retained placenta and she needs to get to her OB and get checked and get an ultrasound ASAP, right? It's those things that allow you to be more than a technician hammering on joints and allow you to be a doctor ensuring the safety and the long-term healthcare, long-term health and well-being of your patients, okay? So, really, I mean, I know it's not sexy to talk about urinalysis and pathology, and we really want to focus on health, but we need to understand it. Otherwise, we're going to hurt people in the future. Okay. Now let's talk about the art of chiropractic. Now, if philosophy asks the questions and science answers them, then your art is the way that you express that to the world, right? The art is how you bring the philosophy and science to the world. You absolutely need them. Now, most people think about art in terms of chiropractic technique, right? They think about how do you correct subluxation, or how do you treat a patient, or what therapy do you do at which thing, right? For many people, that's the art that they're thinking about. But art extends beyond that. Art is about, of course, how you take care of your patients. But art is also about how you choose which technique to do in which situation. Art is how you identify which person is a good candidate for care versus which person needs to go elsewhere. Art is how you run your practice in setting up your care plans and deciding how you take care of patients. Art is how you communicate what we do, right? All of these things fall under the umbrella of the art of chiropractic. And this is another thing that you can't wait until you're in practice for you to really explore and delve deep into figuring out what makes sense for you. You need to do this early on. Students, when you first put your hands on people, you are going to be terrible, right? And I say that from a place of, I was terrible because every new chiropractor is terrible in the beginning. I remember when I was in school, every single patient had C2 subluxation because that was the only bone that I could actually palpate, right? Every single person, right? Every single person that needed to be toggled was toggled on the right because that was the side that I was good at, right? And it takes time for you to understand the analysis and figure out what to do and what you're feeling, right? If you're into motion palpation, you need to palpate thousands of spines, right? Now, thousands of normal spines, not chiropractic student, hypermobile, loss of cervical curve, over-adjusted type of spines. But you need to get your hands on thousands of spines in real life and learn what those taut fibers mean. You need to get your hands on and develop the sensitivity, the touch, to be able to figure out how a joint is supposed to move and figure out whether there's a muscular restriction or if it's a ligamentous restriction. You need to be able to palpate if a child needs to be adjusted or if they might have a congenital anomaly that you didn't discover because you didn't do an x-ray on a young child. This is what you develop over time. And I'm going to go on a rant for a second because I'm totally on board with people who say that you want to let innate guide you in terms of how you practice, right? And I'm totally on board with those of you who want to put your hands on somebody's spine and not only objectively analyze them, but you also want to subjectively feel where the energy is and where the tightness is and where the subluxation is. I'm 100% on board. But you don't develop that innate sense of where and when to adjust by meditating in front of a patient for 5 minutes before you put your hand on them. You don't learn it in second quarter before you even understand spinal biomechanics. You don't learn it even in school, no matter how many people you adjust. That innate guidance comes from adjusting thousands of people over years, right? I've just gotten to the point, probably a year or two ago, where I'll start to say, you know what? No, this is where it needs to be adjusted, right? And I'll start to get that sense, but that didn't happen overnight. You have to develop a baseline understanding of technique and analysis and subluxation patterns and how things are corrected slowly over time. You need to develop that before you can ever just trust innate and pretend that you are, God's hands working, on the patient in front of you. Now, that's not meant to denigrate any sort of seminar that you might go to in school, by all means, go to these seminars, because you need to explore chiropractic and figure out what makes sense for you. And you need to get your hands on people. And yes, you should be innately clear and connected with your patient, but still develop an analysis and an understanding of where and when and why and how to adjust that patient. Otherwise, you're just going to be pounding on high spots, and that's not going to get you the type of results that you really want to get. Okay, end rant. The big thing is it takes time, and you need to practice it right now. I was always the first one that would show up to technique labs, and I was always the last one out. I would show up on the weekends to try to get my hands on more people. I would go over to friends' houses to palpate and adjust each other. We'd have palpation parties where you'd have 10 people, and 5 people were wearing gowns, the other 5 people were doctors, and you would just motion every spine. And then when you got to the end, you would switch out with the first person, and then you would continue to motion. And basically you got to palpate 9 other spines, and you'd all talk about what you felt. Where was that subluxation? Great, now let's practice leg checks. Let's everybody lay down and let's go through and figure out what are the leg check findings that you're getting. You develop this over time, and it takes practice, okay? Nobody is a world-class pottery, throwing person the first time they ever touch a spinning wheel, right? That takes time and touch. And one of the things that I'm troubled by is I see a lot of young chiropractors think that they can, go to 1 or 2 seminars and they're done in their learning, right? And I know I have some friends who teach at chiropractic colleges, and they express concern because their students go to weekend seminars and are told one thing, and then they go into class and they're trying to tell the instructor that they're doing it wrong, or they refuse to hear from them. And that's not what we need, right? You as a chiropractor will get to discover who you are and how you want to adjust people. But you as a student should be a sponge, absorbing and sucking in everything you can get, every juicy morsel from every single person about philosophy, science, and art, and technique, and communication, so you can figure out who it is that you are going to be as a chiropractor. Now, how many of you felt like this the first time you started to talk to a friend or family member about chiropractic? Right? You were so excited about what it is that we do, and you just start yelling at them about subluxations and adjustment and this and that. And like the result is that your friends and family tune you out. I still have family members to this day who desperately need to be adjusted, but because I approached it in an overly aggressive, almost militant style, they refuse to get adjusted to this day, right? I have family who had repeat cesareans because they didn't bother to see a chiropractor, even though they know what it is that I do every day. Simply because in the beginning stages, I invalidated who I was as an authority in their eyes in terms of chiropractic. What I mean by this is you don't always get an opportunity to figure out how you're going to share chiropractic with the world. So you need to practice this now. If you are a student, get together with your fellow students and just talk about subluxation or chiropractic or how it affects pregnant women and children. Just talk about it. Get used to talking about what it is that you're going to do for the rest of your life. Practice, a new patient consultation. Practice your elevator speech, right? If you can't in 30 seconds clearly define what chiropractic is and why it's important for pregnant people and children, then you're really going to struggle to build a practice, especially when you're new to a community. Practice how you're going to communicate in terms of working with an OB or a pediatrician. Everything that comes from from communication is going to be relevant to your practice in everyday life. And so it's really important that when you're practicing the art of chiropractic, when you're practicing putting your hands on people, when you're practicing your technique, when you're practicing even your pathology, practice communicating how you put what you're doing in context for that person. I promise you, right? And I'm not, and some of you who are chiropractors, please, shake your head and nod along if you agree with this. Very rarely are the busiest, best practices in chiropractic created by the best adjusters in the profession, right? Very often, the biggest, best practices are the ones that are created by the people who can communicate the most effectively. How you communicate is going to be what gives you the opportunity to actually put your hands on somebody. Because I will tell you this, the easiest part of perinatal chiropractic is helping people get better and staying better, right? The easiest part of what we do is the clinical care. The hardest part is getting an opportunity to deliver that care, because you need to communicate what you do in such a way that that person chooses, and most often chooses to pay out of their own pocket for your services on an ongoing basis. You need to practice this stuff now. That's it. You don't have any other choices. So let's say that you're a student. What are you supposed to do, right? We don't know what the future is going to be, looking like in terms of school. And this, by the way, same thing for a new doctor, right? What is it that you are going to do going forward? How are you going to delve deeper into the philosophy, science, and the art of what it is that you're trying to do every day? What are you going to read? What are you going to listen to? I'll be happy to share some links. If you are already in practice, what organizations are you donating to and supporting their efforts in research or public relations? Not just being a member of the ICPA, but do you potentially ever donate? Do you write up research? Are you doing, participating in their practice-based research network? What are you doing to support yourself in delivering this care more effectively and more efficiently to more people? That's really what this is about. So, after we finish tonight, and again, I'm going to open this up for some, Q&A and kind of make this a little bit less structured going forward. But what is it that you're going to do to expand your ability to serve your community? That's the goal, right? That's what I want you to really explore after today. One last thing. About 3 years ago, I shared this story online. And I did it on my personal page, which I very rarely do, but somebody had told me that chiropractors should stick to back pain, right? That if chiropractors just stuck to musculoskeletal pain, we'd finally be accepted and we'd finally be able to, be a part of the greater medical healthcare system. And that day, this little girl named Madison came into the office, and she was 3.5 months old, and she was diagnosed with failure to thrive because she had such severe reflux that she hadn't gained any weight. She was actually hospitalized. She was on 3 medications, none of which worked. Long story short, the chiropractic spiel. We started adjusting her, and very quickly, her life changed. She started eating more. By the second visit, she started interacting with her siblings. A couple weeks later, her pediatrician said she gained so much weight that they canceled all the visits to the specialist. This girl was awesome, right? Exactly what you would want in one of those quote unquote miracle stories. And it only happened because I was communicating chiropractic both on social media and with her pediatrician, that they decided that, yeah, this might be an option when nothing else was available. So I posted this online, and I kind of had a little bit of a snarky attitude. I said, this is why chiropractors don't stick to musculoskeletal pain only type of thing. It was my big, middle fingers to everybody who is, doubting the value of chiropractic. And I shared this story, and the thing went crazy. I mean, I don't know if you can see, it's got like 39,000 shares. It went all over the world, not just by chiropractors, but particularly families and parents who so desperately needed what it was that Madison, received through chiropractic care, that opportunity to tap into her potential. And I was struck by the number of messages I received from people all around the world, Korea, Vietnam, Nigeria, Spain, that were desperately seeking an answer for their child who suffered with the same exact problems, right? People who were told that their that their child was lost, that pediatricians had no answer for them, that medicine had nothing to offer them, and they were just told, hopefully she'll grow out of it, right? And I would share with this, I would refer them to the ICPA site, hundreds, if not thousands of people went to chiropractors, which was amazing. But the most common question that I got was, why didn't I hear about this before? Why didn't my pediatrician tell me this? Why didn't I know about this from other moms? And the reality is, it's our fault. It's not a pediatrician's responsibility to understand perinatal chiropractic and, you know, figure out where and when and why and who to refer to. It's our responsibility. And if we want to look at the state of prenatal care, the state of birth, the state of pediatrics, the state of healthcare as a society in our generation, we have to look at ourselves and figure out where we failed, where we haven't acted, where we haven't done what we could do to share this amazing, you know, thing that we call chiropractic. And that doesn't happen, you know, unless you understand the philosophy, the science, and the art of chiropractic. And that's what this is all about, right? You know, my motivation is that every Madison in your community, every Madison and every Trisha in your community have access to the services that you provide day in, day out, and they just don't know that you're there to support them. That's what this is about. And, you know, each month we're going to go deeper into, you know, we're going to go deeper and deeper into this, this conversation. And so I want to, you know, open things up, see if you have any questions, any comments, any thoughts, any ideas at all that specifically related to kind of what we talked about tonight, right? We'll go deeper into other things, and I want to hear what topics you want to hear. But what came to mind? Did anything challenge you, right? If you went to a school that didn't talk about subluxation, are you just really put on the edge of your seat, uncomfortable with the idea of subluxation other than a historical footnote? If you went to a school that talked about something else, like where are you? What's coming up for you as we go through this, as we talk about it? So feel free to unmute yourself and, you know, one person at a time. Yeah, Alexandra, I see you waving your hand.
Yes. Hi, Dr. Ian. Thank you so much for doing this. Hi, everybody. I am a first-year practicing doc here in Greensboro, North Carolina. Again, all principal chiropractor, brain-based kind of thing, you know, all of that. But I think the biggest issue that we have as a profession is testimonial sharing. We don't really, I think one of the things that we could possibly work on as a group is creating a base where these established docs actually have testimonials that we as new practices can dip in and share with our community, as this is what a real true miracle story is when you have a clear and fully functioning nervous system.
Yeah, I mean, the reality is, you know, we have a profession that tends to only share our success stories with ourselves, but we also don't do it in a very effective way when we do share it with the world. You know, I'll give you an example of that. There was a well-intentioned student this week who, in response to the murder of George Floyd, used that as an example. You know, the foot to the back of his neck, use that as an example of what happens when a bone in the spine is misaligned and how that cuts off life. And, you know, it was a painful kind of level of not reading the room and really not understanding the greater context in the world. But it was also a comparison that just wasn't, you know, you and I as chiropractors can probably understand what he was trying to say, but it's the type of thing that would not only be ineffective at, you know, getting other people to chiropractic, it would actually turn off a lot of people from ever considering chiropractic. And so we need to learn as a profession how to share our stories in a way that is going to be resonant, and it's going to be influential and inspirational, and it's going to be a call to action for people to start to want to engage with chiropractic, not just chiropractors jazzing each other up at session, you know, at seminars. on a tangent, my biggest pet peeve is going to these chiropractic seminars and having speaker after speaker blow smoke up your ass about how flawless their process of chiropractic is and how brilliant they are as a chiropractor and how all you need to do is believe and whatever. I think that all that's just garbage, and I don't think it does anything to serve the greater chiropractic community. I'm going to share with you areas where I've fallen, right? I'm going to share with you areas where I failed. I'm going to share with you the times that I've truly screwed up, whether that's, taking care of a patient or whether it's, building a relationship with a doctor, because just as much as we need to hear those testimonials and we need to learn how to share them, we also need to learn as a profession how to learn from our mistakes and share those mistakes with others. I think our profession needs a big slice of humble pie, because chiropractic can be tough, right? Practice can be difficult. People make mistakes, and all of that's okay, right? It's going to happen. It's funny because part of my lecture for the ICPA is all about teaching people how to communicate with the public and with practice members and with other professionals about chiropractic. So yeah, we'll definitely spend some time talking about that. Thank you.
You're welcome. Thank you.
Anybody else have something that came up for them?
Hey, Ian.
Hi, Megan.
Hello. I really like what you said. Just kind of echo, if you could talk more about the inroads that you were able to make with those birth centers and other birth professionals and things like that, to really get to have the practice that you have right now. I think just hearing, hey, that would be great.
Absolutely. One of the things that I'd like to do is not only have a conversation about the value of building relationships with other healthcare professionals. I'd actually like at some point in the future that we can actually split off and kind of do role playing one-on-one, right? One person is the chiropractor, the other person is a medical doctor, and you need to communicate what you do to them in a compelling way for them to understand the value of referring to you. We can do the same thing in terms of a new patient, consult or a report or, difficult questions, right? So I do want, as we go through, I want this to be more interactive, and that's one of the reasons why I'm doing this in a format of a large meeting instead of a webinar, because I want everybody to be a part of it and not only ask questions, but be able to engage and talk about things that they otherwise, weren't going to be able to cover. So yeah, Megan, we'll absolutely talk about that. Thank you for bringing that up.
Hi, Dr. Ian, it's Carla.
Hi, Carla.
Something that came up for me during this discussion, first of all, thank you so much, inspiring. Thank you for acknowledging everything going on in the world. But something that came up for me while you were talking, so I go to Kaiser University. It's an evidence-based program. And what was interesting is every time you said subluxation, I'm conditioned to replace that word with somatic dysfunction. So literally every single time I'm like, you said it, I just replaced it. I'm like, wait, what is that? Oh yeah, somatic dysfunction. So I appreciate this session, and I want to dive deeper into, I know I've shadowed you, so I am starting to understand more of what subluxation means. And so I appreciate the session, and I definitely want to dive deeper into correcting the subluxation. And then my only question for you was, what do you recommend students getting their first certification in? I know there's a whole series, and what would you recommend for students? Thank you.
Yeah, I think it's tough. There are phenomenal chiropractors that have come from every single school across the spectrum of, philosophy. In the same way that there are really amazing chiropractors that came from schools that don't have a lot of philosophy in terms of, what I would refer to as chiropractic subluxation based care. There are also a lot of really bad chiropractors that come from, quote unquote, really philosophically strong schools. And so I don't think it really matters where you go to school. I do say that where you go to school might affect the opportunities you have to be exposed to some of these topics. And, I'm in West Palm Beach, which is, or a suburb of West Palm Beach, which is where Kaiser University is and where Carla goes to school. And you know, we actually had planned to do this as like a kind of an in-person thing just for Kaiser students, because I wanted them to have an opportunity to get exposed to these topics where they otherwise might not get to them in school. And we actually had it scheduled, and because of the COVID thing, we had to cancel it. So, you know, Carla, thank you, because this is, you know, part of this motivation for doing this was, you know, because of your desire to learn and be explored, you know, exploring these topics. I think the big thing that students should do is try to expose yourself to as much of the profession as you can imagine. My dad, I worked for him for a summer, and every single Tuesday, he sent me to a different practice in South Florida that crossed the spectrum. I mean, I saw guys who see 2 people a day. I saw people who saw 300 in a day. I saw people who all they do is adjust. I saw people who rarely adjust. I saw people who are family wellness. I saw people who are personal injury, you know, exclusively. And I got exposed to the entirety of the profession, which I think in my case allows me to understand where people are coming from and understand the different aspects. You know, it's why I don't think that anybody's wrong for their approach to chiropractic, but I do think that what you want to, how you want to practice is dependent on your philosophy and your ability to be exposed. Because I'll give you an example, Carla. You know, if you went to school and you listened to your instructors and you refer to, you know, some somatic dysfunction, right? And you decided that you were going to go out and you wanted to serve pregnant patients, right? Your context for how chiropractic could serve pregnant patients would almost be exclusively limited to musculoskeletal pain, right? How you could help them with back pain, how you could help them with the aches and pains of pregnancy. And you would absolutely do a wonderful job of helping them physically feel better. But you may not provide the same level of care that you could now that you understand the subluxation has an impact beyond musculoskeletal effects, right? So it's important that if you go to a school where you don't just get like fed this stuff, or even if you do, right? If you go to where I went, you know, in life, and you get exposed to plenty of this stuff, or you go to Shulman or one of these other schools, you should still go outside of your school and visit chiropractors. Visit chiropractors with big practices, visit chiropractors with small practices, pick their brain. Just sit there with like an open brain, like, and just absorb everything you can so that you can organize it in such a way that you figure out who the hell you're going to be as a chiropractor. And then once you figure out what you want to create, find the people who are doing it and use them as guides about what you need to do going forward. Right? So I would say if you want to work with any pregnant patient, as a bare minimum, you should do the Webster certification. As a bare minimum. You know, that's the class that Jeannie taught for decades. Pam Stone is now teaching it. They've got a session coming up in Daytona in, I think, July or June. So, you know, it's easy since you're in Florida. But these are things that I think as a bare minimum, you should go to Webster Technique if you ever want to touch a pregnant person and if you ever want to adjust a child, right? That'll give you a really good foundation, a starting point. And then if you want to continue with the rest of the ICPA series, amazing. They're great content, great instructors. If you decide that you need more work in communication, there are other, you know, groups or practice management companies that might support you specifically in the context of the type of practice that you want to create. So again, you can't figure any of these things out if you don't define your philosophy and who you are as a chiropractor. Otherwise, you're just kind of stuck hoping you might accidentally, you know, find yourself in the right place, you know? So we'll talk a little bit more, you know, detailed as, you know, as we continue.
Thank you.
Anybody else have anything coming up for them? Was that it?
One more question.
Okay.
Do you have a tattoo of a mermaid on the inside of your arm? Is that what? I'm very serious. What the heck?
I have a
is
tattoo
that?
of a seahorse.
Okay, thought it was a mermaid. All right, never mind.
Oh.
Continue.
So when I started working in the birth house, you know, I've had this fascination ever since Jeannie's class. I've had this fascination with pregnancy and birth because I truly saw the process of half a cell and half a cell coming together to create life, and all of this happening with a person never needing to go to school to how to do it. Like, it just became the embodiment of everything that was amazing about chiropractic. And so I decided that I wanted to go out and really work with this population. And I developed an amazing relationship with a midwife and a doula that I started working in the birth center. And 9 years later, the doula and I still work together in the same facility that it's just been an amazing relationship. But we're sitting at a restaurant one day, and there's a TV screen, and it's like an aquatics type of documentary, and there's a seahorse. And I leaned to them and I said, did you know that the male seahorse is the one that carries the baby and give birth to the young? And the doula took a sip and looked at me and goes, you wish you were a seahorse, don't you? And it was just like this perfect thing. And so they kept calling me seahorse. At one point during my birthday, they sat me down and all pranced out to Under the Sea by Little Mermaid. They once got me a costume. If you've ever seen the picture of me in a full seahorse costume, that was them. So seahorse kind of became like, a representation of my love of prenatal and pediatric care. And it also became a representation of my role as a father to my two boys. So there's actually a little A and B, for their initials on the inside. And I warned my wife, I said, that when we were done having kids, I'm gonna expand it and add like little baby seahorses, that are gonna match their personalities. So anyway, yeah, I don't have a mermaid, but because of my work shirt, that's what people see most of the day. And so a lot of people think I just have some weird tentacle hanging from my armpit. I didn't realize that it was gonna be that big when I first had it done. But yeah, I have a tattoo of a seahorse. Yeah. Questions, comments?
I have a question. Can you see me? I can't see myself.
Yes. Hi, Anna.
Hi. Sorry, I'm like in the one little bit of light here. I want to take off what you said and then also give a question. So I totally agree. I just graduated and I definitely got the most experience for sure going to different offices and seeing how different docs do things. It really changed my philosophy of care, which is really great. So just take that how you want, students. My question is, how do you communicate well to patients, families, husbands about chiropractic care for kids? In school, we're given very little information and I have my own philosophy on it, but where would you start with that?
So communication is a huge part of what I want this group to delve deeper into, because it's so important to be able to communicate what you do. And it's tough because in school, you're so focused on, passing classes, getting through boards, getting to the next step, the next step, the next step. And when you realize that you're done with all of your steps, you're standing on the top of a building and you have no clue how to, talk your way down.
Right.
And so some people just jump and hope that they end up landing. And some people have to really go through a long, difficult process of figuring it out on their own. And a lot of people never know how to communicate it, and they end up falling into a type of practice that they never really wanted. It's a lot easier to talk about pain-based, chiropractic. It's a lot easier to sell somebody who's got an acute low back that the value of chiropractic is, in helping alleviate their pain. It's not as easy when you're talking to a family of a newborn, and you're trying to explain to them the role that a chiropractic adjustment may have in how that child develops and expands the world. Or interacts with the world, and how their entire developmental process is affected. And I think the big thing that most chiropractors fail at is they jump to try to talk about how chiropractic helps. They don't explain why chiropractic is important. So what I mean by that is, if I start talking to you all about how wonderful chiropractic is and how it's going to transform your life and how it's going to help all of these areas, but I never explain to you subluxation or what the adjustment does, then everything that I just said it sounds no different than the person at the mall selling, you know, energy wrist straps by doing muscle testing,
Yeah.
right?
Yeah.
It doesn't resonate with the person.
Mhm.
So you need to get really good at explaining subluxation in the context of what this person's values are. Give me a second. I'm going to get my pelvis.
Okay.
Okay. So let's pretend for a second that I'm going to communicate chiropractic for a pregnant patient. Okay. And somebody give me a patient that's in their office. You can make up a background. You can make up their presenting complaints. You can make up whatever you want. Just give me an example of a patient.
A pregnant patient or a kid patient or whatever.
Let's start with pregnant patient.
Okay. We'll say left leg sciatica pain.
Okay. How far pregnant are they?
7 months.
What type of birth are they planning?
Vaginal.
Are they have they been pregnant before?
No.
Okay. Have they ever been to a chiropractor before?
No.
Okay. Are they having any other symptoms, right? This is just to make sure I'm covering my bases. No other symptoms. It's just, you know, you've already ruled out red flags, right? Okay.
Yeah.
So what I want to do is I want to talk to them about what makes our office and our approach different from any other chiropractor, right? In South Florida, we have a chiropractor on every street corner, right? Like not just every street corner, every intersection, the four corners of an intersection, there's a chiropractor. And every single patient that's in my office has to drive past at least one to get to me because my office is an actual, you know, absolute BFE. Right? It's in the middle of nowhere.
Mhm.
I moved to this practice because I found this little shopping center and I was like, oh, wow, look at all these new communities around us. This is going to be amazing. Let's move here. And I opened up a practice and I signed a lease and I realized every single impressive community around me was a retirement community.
Hmm.
And so everybody has to drive to get to my office. But the reason they do so is because they recognize that what we do is different. So I need to speak into that. In the same way that, Anna, you need to communicate to a patient, not about chiropractic, but about why your approach to chiropractic is going to support them in accomplishing what they want to do. Because you have to realize people don't take action unless they see value of that action and that value exceeds their own circumstances. Okay, so your job is to communicate value. So you communicate value by making sure that you make a mental note of what it is that they want in their life, right? So if this person just cared about, the pain of her sciatica and she was planning a cesarean birth and she didn't really care anything about preparing for birth, she just had sciatica because it was getting in the way of interfering with her kids and all this, I might communicate a little bit differently, right?
Right.
But if a mom wants a vaginal birth, I'm going to show them how subluxation will not only create the symptoms that they're coming in with, but it can also interfere with their ability to progress and have the birth that they want to have. So for example, I might start off by saying, we need to understand what might be happening in your pelvis. Your pelvis is designed to be able to move back and forth, right? These joints back here, these SI joints, are absolutely essential to supporting all of your weight from your upper body coming crashing down on these joints. And when your pelvis is moving properly, not only does it allow the muscles to move and your body to feel good, it also allows the pelvic opening to fully expand, right? To fully open up and allow more room for baby in order to get through. Here's where things go wrong. The changes that happen in pregnancy, your hormones, the increased weight gain, your change in your compensatory posture, all of these things that I would normally go into deeper, cause these joints to be susceptible to subluxating or shifting. That shift does a couple things. Not only does it create inflammation at the SI joint and affect the sciatic nerve that passes right through here, contributing to the symptoms that you're experiencing right now. But that subluxation will also disrupt your ability to have the birth that you want to have in a couple different ways. First off, your uterine ligaments, right? The uterus that houses baby and allows them to get into the right position and allows the baby to be contract and pushed through the birth canal. That uterus is attached to the inside of the pelvis at several different parts. And if the pelvis is twisted, that's going to pull on the uterus and make it harder for a baby to be able to find the best position. And it's going to make it harder for the uterus to contract efficiently when it comes time for labor. Or baby's head may not engage properly with the cervix, and the pressure that the cervix needs to initiate the release of oxytocin and start that positive feedback loop may not occur, in which case you may need to be induced, or you may stall in labor because things aren't progressing appropriately. Okay.
Right. Mm-hmm.
The second thing is that when this pelvis is shifted, it doesn't allow the pelvic floor to expand, which means it makes it more physically stressful, physically difficult for your body to expand, but it also puts more stress on baby's neck as they're passing through the birth canal. And then finally, the same nerves, just like the sciatic nerve that's affected by this subluxation, the nerves that go from here towards the inside, the reproductive organs, like your uterus, like your ovaries and everything else, those nerves can't communicate as well, which means your ability to go into labor, progress through labor is going to be altered by that same subluxation. So what we need to do as a chiropractor is not only help you feel better. There are lots of people who can help you feel better. But we need to correct the underlying biomechanics of that pelvis that's going to both allow your body to feel better, but more importantly, allow your body to work better so that you can be best prepared for the birth that you want, and your body have the full healing potential to transition into motherhood afterward. That's what we're going to focus on. And here's how we're going to do it. You kind of go into it, right? So part of the issue is that a lot of chiropractors, when they're doing these consults, they fail to connect the dots for people. Now, what do I mean by that? Let's pretend that this person was already pregnant before, right? This is her third baby. And she tells me that she'd like a vaginal birth. And she tells me that, she needed epidurals with the last two, or, and she really doesn't want to have an epidural this time. Or let's pretend for a moment that she had a cesarean and she's going for a VBAC. I want to ask what it was that led to that previous C-section, because I'm going to make sure that I connect the dots to explain how that subluxation may have been a contributing factor in her previous births. Because let's be honest, this pelvis, as your child learns to walk and is constantly falling on their butt, it is traumatizing those SI joints and creating a situation that by the time women even think about pregnancy, they are already decades into a muscle pattern or a muscle movement, muscle memory and movement patterns that have predisposed this pelvis to a subluxated state. Most of us are able to adapt to it fairly well because our ability to compensate is pretty large. But once you get pregnant and your hormones change and you no longer have that same stability in the pelvis, now you're symptomatic. That's why you could have years, if not decades, worth of degeneration or changes in the pelvis, and you don't realize it until that person gets pregnant and they're like, well, it just started. Yeah, but just because it just started doesn't mean it just happened. When you connect the dots for them, it allows them to see the chronicity of the subluxation and allows you to really emphasize the importance of ongoing care and why they may not feel better after one adjustment, and why this is going to be important not only for them, but for their children as their child is going through the developmental stages that you're referencing. So let people see how everything is interrelated and talk into the values that they want, right? Why are they coming to you? Make sure you reference those things. Does that support you? We were going to go into that a little bit more detail later on, but I felt like maybe you wanted to get
Yeah, I really appreciate kind of the overflow, because it is hard to talk to people, and I'm a very much wellness-based doc, so I like how you explained it in a way that it wasn't just about your symptoms, because for one, then they're not going to stay, because once their symptoms are gone, they're better in their head, right? So I really like how you explained that really thoroughly. That was helpful. Thank you.
Good. My pleasure. Any other comments? Anybody who's going to turn off their mute for a second and bring something up? Was anybody challenged or anybody disagrees with me on anything that I shared tonight? Like, I would love to hear, I mean, if you go to a school that has a different philosophy, or you, and as you know, as a chiropractor, have a different philosophy or different approach, and you want to challenge me on something, I would love for us to have a debate where everybody can feel safe talking about, you know, their struggles or areas where we disagree. So feel free to bring that up also. No?
I definitely think you challenged us with the defining your philosophy. I'll share a fail of mine, if you will.
Please.
I had a mom who I saw her all through her pregnancy. I mean, she was, I think 3 weeks when she first started coming to see me. So I saw her all through her pregnancy. She had her baby right before all of the COVID stuff. And she didn't want to come in right after, which, okay, I get it. So she scheduled an appointment to come in. This was this Friday past. She scheduled an appointment for she and baby to come in and get adjusted. And this was her first time leaving the house since she had her baby. And she had a home birth. And she comes in, and you can just see the sheer terror on her face of just like, this is the first place she's literally walked into. Yeah. And she says, you know, I think I'm just going to get checked, and we'll make another appointment for baby to get checked like later on. And in the moment, I felt like I needed to, I guess, make her feel comfortable. So it's like, okay, you know, that's fine. You know, let's at least get you checked, you know. And of course I'm asking about baby, but I never got to lay my hands on this newborn baby. And as I'm sitting here listening to you talk about philosophy and defining your philosophy, like, that's not okay. It's not okay, because even though, you know, baby's feeding fine, baby's gaining great weight, this, that, and the other, without her being checked, we don't know if she's thriving to her full potential. And so that's a fail on my part, because that means I failed to educate mom as to why this is absolutely necessary for this baby, regardless of what's going on around her. So I guess that's a push for me to define my philosophy and walk therein and be able to communicate that effectively with my patients, because now I got to figure out, okay, how am I going to fix this? Like, I can't let this go on. Like, how am I going to fix this? So definitely feel challenged, and definitely feel like I got to do more. I got to do better.
So let me let you off the hook for a second, and I'll tell you that every single chiropractor who takes care of pregnant women has the exact same situation come up way too often.
Yeah.
I have patients who come in after birth, and even though they were the most vocal in how much chiropractic has helped them in pregnancy, they have never gotten their children checked. And we have to realize that, you know, very early in my career, I took everything personally. And when I say personally, it was like I would literally beat myself up emotionally if the person who, you know, came in didn't continue care. And I would go down this rabbit hole, right? And some of you, you know, those of you in practice might resonate with this, that if you have a really good day and you have new patients starting and everything's amazing, then you feel really good and you go home and it was an amazing day. And then you have a day where a patient discontinued care and somebody was complaining because they weren't getting the results they expected, or a new patient decided not to start. All of a sudden you go home and you are just spiraling downward, right? I'm a failure. I'm never going to succeed. I'm terrible at this. And I would do the same thing. You know, I'd be in a situation where I'd have a family that I knew their children could benefit from chiropractic. I knew it. And they wouldn't start care. And what I quickly learned is that there's things that you can control and things that you can't. But more importantly, you have to realize that you don't get to control every situation for the people in your office, right? For the patients in your office. And you can't beat yourself up over the things that you can't control. So what I started doing was I developed this, phrase. And if you've been to my ICPA class, you've probably heard this, which is, I am not my results. And what that means is, you know, if you extend it further, I am not my results, but my results show me who I was being and what I was doing to get to that moment. Well, why is that powerful? Because if you have a result in your office and you don't take inventory of how you got there, either if it was a success, it was luck. If it was a failure, you're going to do it again, right? Because you haven't identified your ability to contribute to the situation, right? So when I have a consult that goes really well, I'll stop and I'll say, all right, who was I being? Well, I was connected and present and passionate, and I was attentive, and I was being all of these things that would allow this person to feel safe and choose to start care. And what was I doing? Well, I followed my communication flow really well, and I connected the dots for them in different ways, and I really inspired them about what was possible through chiropractic. And those are the things that allowed this person the space to be able to choose to start care. And if I didn't have a good consult, I would stop back and I'd say, all right, who was I being and what was I doing that made this consult not turn out the way that I wanted it to? And so what that quickly did was it gave me this freedom where it wasn't that I was blaming myself, but I was able to take responsibility from a place of, there are things that I can do to influence the future, things that happen in the, future instances. And the reason why I think that is so important is because what you should do in that situation is take a step back, not feeling bad in any way, but ask yourself, what did I miss in terms of who I'm being or what I was doing that might have influenced this woman's decision to get her child checked? In many times, I find that if somebody doesn't get their children checked, I'll look back at my consult and I'll say, you know what? All this time in the consult, I never talked about the importance of getting baby checked afterwards. I never sent them the email explaining, why we check kids in the office, right? Because a lot of times, especially women who are coming in pregnant, very often their spouses, their partners don't come in to join them for a visit. And so now that partner is having to rely on communication, from a person who's just now discovering chiropractic in order to make a decision about whether they get their child checked. So I would very often be able to look back and realize that I was either not being or not doing who I needed to be and what I needed to do in order to make it easy for that person to choose chiropractic. Now, the other thing that you need to realize is when you take inventory, if you can't think, well, first off, when you're doing that inventory, you're not using that as ammunition to beat yourself, right? Because that's what I did in the beginning. I'd say, oh man, I forgot that. I am so stupid. I'm such a horrible chiropractor. I'm never going to get this right. What you're doing is taking inventory so you can figure out how to improve and how to get better, how to get more effective at what you do. And so I started doing this, I would do that. And then the other thing was I had this new patient consult that was absolutely amazing. And I thought this person was great. We adjusted, it was wonderful. The next visit, she calls up and she says, I can't come in today, and hangs up. And like a week goes by and I never heard from her. And I'm going down the rabbit hole. Like, what did I do? I so messed up. That's when I started taking inventory to try to figure it out. And I couldn't understand where I messed up. It had to be my fault. So she calls up and she says, I'm so sorry I had to cancel last week. I woke up and I was bleeding from my anus. And I had to rush to the emergency room, and I just got released last week. I'm ready to come back in and start care. And I started laughing, not because this woman was having rectal bleeding, right? I started laughing because for the last week, I had spiraled down to a point where I was convinced that my family was going to be living homeless on the street because I was such a terrible chiropractor because this woman didn't come in for her visit. And the reality was she was just bleeding from her butthole. So there are times in practice that it is legitimately your fault, that it is legitimately something you missed, either in who you were being or what you were doing in your interactions. And then there are times that somebody's just bleeding from their butthole. right? They might have financial issues. They might have their own fears and circumstances that they haven't quite overcome. They might have a spouse or a partner that's not supportive. They might have a pediatrician that planted a bad idea in their head. It may not be your fault at all. So assess where you're coming from a place of how you can better serve people. Don't use it from a place of beating yourself. And then always keep in the back of your mind, well, maybe she's just bleeding from her butthole.
I like it. Thank you.
Yeah, my pleasure. That's a story that usually goes better when it's in person. I can actually hear laughter. It's a very weird experience, not hearing anything, because I have absolutely no idea how anybody's responding. So it's all right. But any other ideas or things that came up after you know, from today? All right. Well, listen, I hope. Oh, go ahead.
One last comment. You mentioned the wellness practice. I have his book. So
Oh yeah.
how do I get the CDs?
I will track down where you can get them,
Okay.
whether it's on like YouTube or in person, and I will include that in the link when I send out this recording.
Perfect. Thank you so much.
Yeah, my pleasure. You know, so I'm listen, you know, we've been here for 2 hours, and I am genuinely I'm really honored that you've taken 2 hours of your Monday night to be a part of this, and I hope it provided some value, and I hope that it inspires you to continue these conversations. I'd like for us to be able to do this like a monthly type of thing. I'd like for us to get together maybe the first Monday of every month and, you know, go through deeper onto some of these conversations and be active, you know, not just you listening, but actually have conversations and going back and forth. So please, you know, I'm going to send out the recording tomorrow to the same listserv. So if you got that, please, you know, check that out. But I'm also going to put out a call for topics. So if there are things that you're struggling with in school or in practice or in your understanding of how all of this makes sense, you know, in your current education, that's okay. I want you to let me know so that way we can talk about it and, you know, go from there. Deal? All right. Well, thank you guys so much. I hope this was provided some value. Please, you know, when you go into practice tomorrow morning, the world needs a tremendous amount of love and it needs a tremendous amount of healing. There are people who are experiencing a level of fear and not being welcome that is just inhumane. And I think one of the things that we can do in our offices is make sure that our practices are safe places where anybody who wants to come in will feel safe and will feel confident that we're. You know, I had a really strong emotional finish and I thought that was just awesome. And then I realized you guys were all frozen again. So, you know.
It was great. It was great. Thank you.
Listen, you know, long story short, just tomorrow come from a place of love and serve everybody. And let's just be a commitment to constant and never ending personal improvement. I think we can do some amazing things. And the number one thing I'm going to work on is establishing a better internet connection for next month. So thank you guys. And feel free to respond to my emails if you have any questions in the meantime. All right, guys, have a great night.
Thanks, Dr. Ian.